Good morning, Mr. Mason. My name's Olivia, and I'm going to be your RN. We're going to be Skyping, talking about a little bit about your current diagnosis of congestive heart failure, and I'm here to provide further education on top of what your doctor and healthcare provider have already told you. This is going to be a presentation and continuing education on how to monitor your weight gain and loss, and when you need to watch out for symptoms and when those need to be reported. So I have a couple questions. I see that I'm reaching out to you because we got an email saying that you needed some help, a little bit more education. And if you have any questions or concerns, feel free to ask me during or after the presentation. I'm going to be providing you information with some handouts, which I included in your email. And also I'm going to be providing a demonstration on how to properly weigh yourself, along with recording those documents with daily weights. So before we get started, I'm going to ask you some few questions. So you do have access to internet, correct? Yes, okay, perfect. Since I got your email, I just wanted to make sure that you have regular internet access. Do you have a printer at home? You do, great, okay. So these provided handouts, you can print out all of these, especially this one. This one's going to be a chart that's going to be very helpful for keeping track of your daily weights, and that just keeps you very organized and it's easy to have in front of you. My other question would be, do you have a scale at home? Digital, or it can be the dial one. Digital? Okay, good. So later in the presentation, I'm going to be providing a demonstration on how to properly weigh yourself. And then again, if you have any questions or concerns, feel free to ask. So what I'm going to do is just give you a little bit of information first before I do the demonstration on, if you refer to your first handout in your email, this is going to be a self-check plan. And this is going to give you just some cautionary what you need to pay attention to of your worsening condition of your congestive heart failure without the use of the scale directly. And these are just some signs and symptoms that you need to monitor. You can make sure along with your handout here, it says comments on the side here. Feel free to fill that in with anything that you may feel changing, any way that you feel. Maybe you're a little bit more short of breath than normal, or maybe you notice some swelling or edema in your lower legs. That would be a good indicator of worsening symptoms, and if you monitor and collect those throughout the weeks, you can see whether or not it is worsening or improving. So with this handout, I'm just going to read a couple of these if you want to follow along. These are going to be the signs and symptoms you can look out for with that fluid retention, and this can show weight gain without using the scale. So if you're presenting with these are all acute onset symptoms that are sudden, that these suddenly happen. It is not something that normally happens. It's something that's changing. It may show that your condition is worsening or having an acute episode. So if you have an increase in dry or hacking cough, you're going to see worsening and shortness of breath with activity, or even getting up and ambulating, walking around if you suddenly get short of breath. The increased swelling, you're going to see it in your legs, ankles, and feet, possibly more on your abdomen. You're going to see some abdominal discomfort with that swelling as well. And with trouble breathing, you might have some sudden shortness of breath when lying down flat. If it's uncomfortable suddenly to lay down flat, that could be that fluid buildup. So again, any of these, you could have loss of appetite, new or worsening onset of confusion, fatigue, dizziness, sadness, or depression. All these symptoms you want to record. If it's something that you slowly notice happening, or if these are sudden or onset, you definitely need to contact your health care provider, and they will most likely recommend you to either go to your physician's office or go to the ER. That way you can get proper medical management. So what I'm going to do, so now that we have this, and this is available through the email that I provided for you, you can print this out and have this given to or hanging up somewhere so your family members can see it, or you can give a copy to any family member that is taking care of you. If you suddenly become have a lower level of consciousness, they can look back on these and kind of see, you know, maybe I should call the healthcare provider if I notice any of these. You are not able to tell them. So the second handout that I'm going to be providing you, it has a scale with a feet on it. It's going to show you how to properly weigh yourself and when to. So what is important on here? It says it is important to monitor your weight. And it's important to monitor your weight because for congestive heart failure, when you retain that fluid, it can put excess pressure on your heart and that can make it worse. So with this weight gain, it puts extra pressure on your heart, which makes it more difficult for the blood to circulate throughout your body. And that's when you have issues. And that's what we want to avoid. So this daily weight can show if your condition is worsening by that weight gain, and what you want to do is catch it as soon as possible. That way you can get medical management or alter something that may be causing this excess fluid buildup. So what you're going to do, I'm going to provide a demonstration later, but what I'm going to do is just explain on how to weigh yourself at home. So what you want to do, you want to weigh yourself first thing in the morning. You want to do it when you first wake up. If you need to go to the bathroom, try to encourage it to complete that first urination. And what you're going to do is you're going to weigh yourself right when you wake up after that first urination before eating or drinking anything. You want to either wear what you were wearing to bed, something light clothing, because if you wear heavy clothing to bed, that can add a few pounds on to that, and you want to get an accurate reading of your weight in first thing in the morning. Do you have any questions so far? Why you need to weigh yourself in the morning? Good question. So why you want to weigh yourself in the morning is because all your body has settled down and you are not digesting food. Your body is relaxed when you are sleeping. So when you're up and active throughout the day and you're eating and you're drinking a lot, that can add you lose and gain weight throughout the day, and that is not a very accurate number that you want to contribute to that weight. So what you want to do is, with this handout provided you your weight check, each day you want to provide that weight, and that's a good way to monitor your changes, and you want an exact number. Like I said, it could be off if you do it throughout the day. If you've completed a really heavy meal, that might add 1 to 2 pounds just because your body has not absorbed anything from that huge heavy meal. So you really want to do it first thing in the morning before you eat or drink anything. And that way you can get an accurate reading. And what you want to do, so the number, and again, on this handout it says above here, and if you forget, if you gain more than 2 pounds in one day, that is a red flag, along with an extra 5 pounds a week is a red flag. So those are when you need to call your health care provider. Do you have any questions on that? No? Okay. So when you weigh yourself, you want to make sure that your scale is on a flat, hard surface. You don't want anything on an unbalanced scale that could alter the weight. You also want to place your weight distributely evenly with your hands to your side along with stepping on that scale. So this handout right here I've provided for you, it gives you a day, and this is about a good month that you can do, and you can record your weight, your date, name, and again it tells you whether or not when you need to report the 2 pounds in one day or 5 pounds in a week. And it has this comment section up here, and then like I said earlier, this is a good way to monitor some simple changes in your moods, in your how you're feeling. Maybe you feel increased shortness of breath only when you wake up, or maybe when you're taking a long walk, you notice when you stop, you have that increased short of breath or that increased heart rate. Those are some comments that would be good to know. And you can bring this into your healthcare provider and they can see a pattern in here on whether or not it correlates to your weight gain or loss. And this is a good handout that you can either program into your computer, keep track on your computer, or you can print it out and write it out each day. And again, do you have any questions? How long do you have to weigh yourself for? Okay, good question. Congestive heart failure is a long-term medical condition, and it's not something that just goes away. This is something that you have to maintain and you need to keep on top of to prevent further damage to yourself and your body. So along with your congestive heart failure, your daily weights are very important, and you are going to have to complete these for a lifetime. And I know that it can be time consuming in the morning, but it really only takes a couple seconds a day to do that. Have your paper right next to your weight, right next to your bedstand. As soon as you wake up, go to the bathroom, complete it, write it down, go on with your day. It doesn't take much time out of the day, but this is something that's really important that can help prevent any episodes of acuteness for your condition, and it can be actually life-saving to know how much weight that you have gained, and that can put, again, additional pressure on your heart, and you don't want that. Okay, so one other thing that I'm going to show you is this last handout here. This is just a scale. There are ways to calculate in the computer. There are several programs to put in your weights from this list. You can actually calculate, and it will show you a pattern of whether or not you have lost a lot of weight or you have gained a lot of weight in either a couple days or weeks. And that can show you a good pattern. There are several programs for that. So before I complete the demonstration, is there any questions that you have so far? No? Okay, all right, good. So what I'm going to do, I'm going to show you a demonstration on how to weigh yourself with a digital scale at home. So like I said, you want to do it first thing in the morning after you urinate, before you eat or drink anything, and you want to be wearing some light clothing. So what I'm going to do, I have a scale here, and I'm going to be showing you, I have a scale here at the bottom, and it's digital. So for this one, you're going to turn it on, and it's going to say 0.0. You want to wait until that clears, and you don't want to, most of them will tell you, it'll say step off, and it'll tell you when to step on. When it has a 0 out of pounds and it says step on, that is when you need to step on your weight, on your scale, evenly distribute your weight, don't lean one side or the other, and place your hands along your sides. Stay still for about 30 seconds, and it'll show you exactly how much you weigh to the point decimal. And that's the number that you need to record in journal, and make sure that you report any changes. So what I'm going to have you do, Mr. Mason, I'm going to have you go ahead and get your scale for me, and I want you to perform using the scale properly. And you can show me how your digital scale works. If you have any questions on how to use it, I will try to answer my best. So if you have any additional questions on how to do anything, there are several handouts that I provided you. You have my email and my phone number personally. You are allowed to call anytime if you have any questions, or if you have any questions about your condition in general, or if you notice weight gain, increasing symptoms, go ahead and call your healthcare provider, and then that way they can help you get the medical attention that you need. And doing this will help improve and monitor and prevent any further signs of congestive heart failure, and it needs to be prevented as soon as possible. So any changes, even little ones, need to be reported as soon as you can, and that way we can prevent further damage and take care of it as soon as possible. Like I said, if you have any further questions, feel free to reach out with me. And then if you don't have any additional questions, no? Okay. Like I said, if you have additional questions or concerns, feel free to email us or call us, and we can help manage with your questions. Okay, thank you so much for listening to my presentations. I have provided all the handouts for you through the email, and you'll feel free to print those out and utilize them as well. You can give all these handouts to any family members or friends too, and that way they can help you keep track and stay organized with keeping up with your condition, okay? All right, if you have any further questions, no? All right, great. Thank you so much. Feel free to reach out to me if you have anything else, okay? It was good to see you. Bye.